Thank you very much, Danielle, for having come today. And I'm thrilled that I actually brought someone with me. Well, I'll give them a quick flash here of my screen. Jesse is going to be talking about his mental illness and his signs and symptoms after we get into talking in general more about what is psychosis and what does that mean and how does that happen to people. So I would like to go ahead and share my PowerPoint with you folks. And that will be followed up by Jesse talking about, how that particularly affected his life. So thank you so much for coming, and let's get started. Oh,
Mary, before you get going, let me just mention one more thing I forgot to say, that if you are looking for CEUs at the end, I will send an evaluation probably tomorrow morning via email that you just need to return to me. And thank you again.
Okay, thanks for that reminder. I hope that got some people interested in coming today. So as Danielle said, I am a volunteer in outreach and also another vessel of outreach, which is FaithNet, where we go out into religious-based communities and talk about mental health and mental illness and the treatments and what NAMI has to offer them. And I love my 4 words here that really do describe what NAMI does. Education, we're doing that right now, right? Support, we have support groups for people with mental illness and also their loved ones. Advocacy, we're out there fighting for people all the time. And my favorite one, of course, is that favorite 4-letter word, which is instilling hope. Trying to find how Danielle has this hooked up. There we go. Had to find out where my clicker was going. So as we said, I'm a licensed social worker and a licensed clinical professional counselor. So today we're going to talk about psychosis. And we really have to cover 3 things. It was kind of interesting to do this because I have several presentations that have all this information, but I had to kind of put them together into one particular package. So first of all, we really want to talk about the first episode, psychosis, okay? And what's its signs and diagnoses, and of course, how important it is to get into some early intervention. But we also want to talk about schizophrenia and schizoaffective disorder, their signs and symptoms. And then we want to hear firsthand from somebody who has to deal with this. So I always start out with the brain. I'm just so fascinated by the brain, and it looks, so wonderful, but it really is so complicated because it's really composed of billions and billions of nerve cells called neurons. And neurons are like these little finger-like appendages that you can see, and we call those fingers dendrites. And it looks like they're touching each other, but guess what? They're not, because what's in between each one of those is a space called a synapse. So how do we get information from one brain cell to another? Chemistry. It's all about chemistry. So there were many different things that are neurotransmitters. Of course, the one that I'm using a lot is histamine, because I need an antihistamine, especially during high allergy seasons and such. So there are many neurotransmitters, but of course, the 3 big ones when it comes to any of the mental illnesses are serotonin, dopamine, and norepinephrine. Dopamine is important. It really helps us regulate paying attention. Hopefully you're all doing that right now. It hopefully gave you the motivation and drive to come here, feeling a sense of pleasure, reward, and your mood. Norepinephrine regulates your alertness and your concentration. So you are hopefully staying alert and using some of your norepinephrine right now. It also does control your energy, your anxiety, and also your. And then the 3rd one, which is serotonin, that regulates your obsessions, your compulsions, anxiety, memory, and mood. So you can see mood is really controlled by all 3 of these. So now that we have a little bit of background on the brain and how it works, we have to talk about what we're here today for, and it's what is psychosis? What is it really? And basically, the definition is really easily learned. It means you are not in touch with reality. Something has happened to you where you are disconnected from reality. And what we have to really think about and really work on making it a habit, that psychosis is not a symptom. It is a symptom. It is not an illness. We tend to call people names with mental illness. Oh, they're psyched, or they're psycho, or they're psychotic, and give them labels. But it is a symptom of mental illness, not an illness in and of itself. And there are so many causes to this. So we have to be really good when we assess people to find out what is going on with that particular person, because there's a lot of medical causes, which I'll cover here again in another minute or 2. Obviously, using and abusing certain substances can cause psychosis. Believe me, if you're under extreme stress, you just cannot take it anymore, you could have psychosis. If you've been traumatized, that can cause psychosis as well. Some different medications, they say on the little box warnings, and of course, those papers that you get with them that you never read say, hey, by the way, this could cause some psychosis. Lack of sleep, especially when people go days or weeks without sleeping. And then there's some genetics involved. We wish we could say that this is something that people inherit. We don't know the genes or the chromosomes, but we can say it's familial. It runs in families. So there is a genetic base to this as well. Now, what's so complicated is there's so many medical causes to psychosis. So we have to have a really good assessment to find out what is really going on with that person, because the psychosis could be a symptom of HIV and AIDS. It could be a symptom of malaria, even syphilis. Alzheimer's disease, Parkinson's disease, people that have extremely low blood sugar, MS, high fevers can put people into a psychotic state, dehydration, and that's probably what's common with elderly. People forget to drink, okay? They aren't watching what they're taking in, and if you go a long enough time without your beverages, you will definitely be psychotic. And of course, if you have a brain tumor, that could cause psychosis as well. So what puts people at risk for this? Well, again, there is a genetic. I wish I could say it's definitely something we inherit, but we do know at least some figures. If you have a first degree relative, now what first degree means, at least to me, is mother, father, sister, brother, of course, your biological ones. Also, identical twins, they have a higher rate of having the same sort of problem. Substance use increases the risk, doesn't necessarily cause it, but it does increase the risk. And if there are any perinatal complications, especially things like low birth weight, cognitive factors, lower IQ, and not doing really well in school. And please don't think that people who have psychosis are stupid and that's why they don't do well in school. They don't do well in school because we talk about all the different things they have to manage. It's really, really tough to pay attention and get things done. So I mentioned about the substances. So we have to talk about those because if you are really regularly using alcohol or other drugs and then you stop it all of a sudden, you can become psychotic. We call it the DTs or delirium tremens. Lots of abuse, drinking large amounts of alcohol or being high on drugs can cause psychosis. And there are certain drugs, if you use them, definitely psychosis is involved. And there are things that, of course, we hear about all the time, things like amphetamines and cocaine and cannabis and LSD, ketamine now. So these are all different drugs that people use that could cause psychosis. Now, I do want to cover the mental illnesses, okay? We did talk about, at least cover a few of them. Schizophrenia, which of course is one of the serious of all mental illnesses, and it really does impact how people act and think and react and feel. Then there is schizoaffective disorder, which is quite complicated because it has the symptoms of schizophrenia and bipolar disorder all together. There is a brief psychotic disorder. That means you have psychotic symptoms that last a day, but no longer than maybe a month. And again, those are often because it happened because of an occurring life event. There is a delusional disorder, which is, again, strongly believing in something that's irrational, that has no factual basis. And there is a form of bipolar disorder where people can have psychosis as well. It's probably more intense with manic phases, but it certainly can occur in depressive stages as well. And people have reported now that psychotic symptoms occur in half, if not more, of people with bipolar disorder. So again, you have to have a really good assessor that can figure out what is the illness and what's going on here. There's also a psychotic depression that's known as major depressive disorder that has psychotic features. And then, of course, there is a postpartum disorder. It's also called postnatal psychosis, women after the birth of a child. So we have to really do a good, thorough exam of what's going on physically with that person. Now, again, there's a little bit of repeat here, but I want to go through those risks because if you have a lot of sleep disturbances, this could really happen, especially with people with bipolar disorder now having psychosis that are having a sleep disturbance. Bipolar disorder, this is an interesting one that I just learned myself from doing all this research, that people with bipolar 1 disorder who give birth have a higher risk of postpartum mania and psychosis. And since psychosis has now been associated with childbirth, we are really looking now and studying and researching the hormones that are involved. And of course, cannabis is the most frequently used drug among people with bipolar disorder. And some people, we're doing some research now. Sadly, we can't do it nationally because it's not approved nationally, but we are getting some research that shows how cannabis can really lead into a psychotic disorder. Now, the one thing, if you walk away today, that I would really like you to remember is we really have to look at what we call early or first episode psychosis, because that's when the person first shows some signs and symptoms where they're losing reality. And I dare say that I'm certainly not going to diagnose it, but this has been something that's been brought up in all of these fatal shootings that we've had. Whether it's a school shooting or a church or a synagogue, you often hear the person themselves or their parents say, yeah, he was a little off, or he did some strange things, or he talked to himself, but no one thought to get the help because they didn't understand what that was. So the most important thing, of course, is to act quickly and get that person the right treatment, and certainly get them a good assessment, because it could change their future and their safety and other people's safety. So what are actually those symptoms of psychosis? Well, people could have hallucinations, and that could affect any of the 5 senses. So they could see, hear, feel, taste, or touch things that aren't really there. Delusions are thoughts that are so real to the person, but they're not real in reality. And I'm going to stress with you this about at least 3 times. The worst thing you could do is argue with somebody who's having delusions or hallucinations actually, because they're true to them. It's their reality. We might not see it or understand it, but it's very real to them. People often talk in what we call word salads, that disordered thinking and speech. They can get easily agitated and have lack of insight, not even knowing what's going on. Again, they have lost that touch with reality. So with schizophrenia, what are some of those early warning signs we should be looking for? Sleep disruption. People get their days and nights turned around. People with schizophrenia really have trouble managing the things that are going on during the day. The lights, the sound, the action, the people movement. So again, they tend to get their days and nights turned around. They withdraw from family and friends. That is actually one of the signs and symptoms. They can't concentrate or pay attention, and they don't take care of themselves. And their speech tends to ramble or be really, really disorganized. They have what we call a flat affect. You can't see any expression of any kind of feeling in their gaze. And like I already mentioned, they're very, very sensitive to light and noise and other people. They tend to act kind of bizarrely and sometimes even dress bizarrely. And they, again, could smell or taste things very, very differently. If they had a very strong religious upbringing, they will be very overly preoccupied with religion. And they have a hard time putting this leads to that. They don't have the ability to understand that. So again, fear of being watched, somebody's out to get me, somebody's listening to me through this computer or through the TV. They let things go. They have horrible declines in both work and school. Again, they don't take care of themselves and that feeling of indifference. When I start working in mental health, and I've been doing this now for 40 years, I just had a really hard time understanding why can't they do it? And it's not that they can't. I'm sorry, it's not that they won't or don't, it's that they can't. It's not a choice. So they have difficulty with these feelings, all part of the illness. And schizophrenia is also complicated because it has both positive symptoms and negative symptoms. Think of positive things that have been added on to the person. The delusions, those thoughts that are really real to them, but not real in reality. Hallucinations, see, hear, feel, taste, or touch things that are not there. And that disordered thinking and speech. The negative symptoms, think of those things as things that have been taken away from the person. Being socially withdrawn and isolated, being apathetic. Again, they can't care. They don't have the drive or initiative to get things done, and it's a hard time for them to be with other people because they're emotionally unresponsive. There's so many different types of schizophrenia, but the one that I really want to talk about today is the schizoaffective disorder. Some people pronounce it schizoaffective disorder, but I'm a schizoaffective disorder sort of person here. So what are their symptoms? Well, this is the most complicated of all the psychotic illnesses to diagnose and to treat, because they not only have all those symptoms of schizophrenia I just went through, but they also have symptoms of depression and mania as well. And this is hard to diagnose because people with schizophrenia usually don't voluntarily go to the doctor and say, hey, I'm having some hallucinations. That doesn't happen because to them, it's not an illness, it's their normal. People with mania often don't go to the doctor for help either because they're great. Life is great. And they don't want to have that energy and that excitement and everything taken away. People often go to their doctor that are depressed, and sometimes it's because they have aches and pains that are really not physically based, they're psychologically based. So it's hard to diagnose, and of course it's very hard to treat, because if you give somebody a medication for mania, wow, there's a chance that that could make their depression worse. And a lot of these medications for schizophrenia are really lower people's moods and ability to get out and about and even think. So what do we have to do for that diagnosis? Again, we need a real thorough assessment. Because of that long list I showed you of all the possible medical causes of psychosis, you've got to rule out any medical problems first. And the other thing you have to rule out is substance use. Definitely need to rule out the medical history and any kind of history of psychosis in the family. Because as you know, that's one of the major diagnostic tools that doctors have even for our medical problems. Is there a history in your family of high blood pressure or diabetes? So again, we're looking for history in the family. And of course, that thorough assessment means we're also doing a mental status exam. We're finding out from the person, do they know who they are, where they are, what's going on in the world today? Can they do simple math problems? That's what I'm talking about when I talk about a mental status exam. Now, there's treatment out there. There is treatment and it all works. And really, the best form of treatment is a combination of all these things together. And of course, that's kind of tough to do because the first treatment that, is out there that people need to have case management. And they need to have somebody that's going to work with them on maneuvering and getting through the mental health system and any kind of problem solving, plus helping them get the right medication. Now, I have here a little acronym ACT. That would be the Cadillac of case management treatment. Assertive community treatment is the number one. Think of it as the gold Cadillac. Because in assertive community treatment, you don't just have a case manager. On your team, the team is for you. You have your own doctor, your own nurse, your own employment specialist. Many of the teams have added a trauma support specialist, and they work 24/7. So there's a team wrapped around the entire person. So that, again, is the gold standard of case management. You'll see under treatment, family support and education is so important. The family, and again, I'm using a broad term of what family is, not just necessarily mother, father, sister, brother, but given the education they need, but also the skills that they need to deal with that illness so that they can help the person with their treatment and with their recovery. Psychotherapy, believe it or not, people with psychosis, even if they're not in touch with reality, they need therapy because they need to focus on their own resiliency and they need to have somebody help them promote wellness and learn those coping skills. Medication management is a really important thing, and sometimes it takes people years to discover what is the best medication for me. And medications often for psychotic illnesses have side effects that discourage people from taking them, because one of the big side effects, of course, is weight gain. And it's not because these medications that are the antipsychotics, it's not that they increase people's, wanting the food. What it does is it takes away the ability to feel full. So it's really tough sometimes to work with people on taking the medication and taking it as prescribed. Supported education and employment, helping people find something to do with their time, something where they feel that they got something done, they did something. Doesn't necessarily have to be even for pay. It could be volunteering. It could be going back to school. Everybody, not just people with psychosis, need to be with people like them. So peer support is so important. People have to be with others who have been through the same kind of experience. And we do have advanced directives, especially people with psychosis need to have them. So if they do get ill, it is all in writing and signed off about where they want to go for treatment, what they want to have for the treatment, and who are they going to put in charge of the treatment when they have lost contact with reality. So that's a very, very important thing to add to the treatment list. Of course, we do want to find out if people do have this psychosis, right? And we want to get into the treatment, but we also want to, as much as we can, stop the recurring episodes, because every time someone has a psychotic break, they lose gray matter in their brain. And our bodies are pretty good. I mean, we can grow our hair, we can grow our skin, we can grow our liver, but we can't grow our brain. So it's very, very important that we don't lose the gray matter in our brain. Now, people with schizophrenia are already having brain problems, as you see, and I'd hate the word normal. I think it would be better to say a person without schizophrenia on the left-hand side, and a person with schizophrenia, not a schizophrenic brain, on the right-hand side, but couldn't find it on the internet. Anyway, you can see how there's just so much going on with the person with schizophrenia, and of course, with the person who does not, it's more cool, calm, and collected. Now, let's go back to talking about that loss of the gray matter. It happens right dead center in your brain. If you look at the left slide, you'll see a little teeny thing in the middle. Looks kind of like a little butterfly. I don't know if this is where I'm going to work here. And then, of course, if you see the right-hand side, now the person is, because of psychotic episodes, is losing gray matter. So that little butterfly there in the middle is getting bigger and bigger, and it will never grow back. Oops, I'm so sorry. I don't know what I clicked on here. These are kind of colorful, but early and late gray matter deficits in schizophrenia, the earliest you can see how colorful it is. And what you don't want to have is the color orange. That's what this is trying to demonstrate for you. Other problems with the brain for people that have psychosis is an abnormality in the temporal area of the brain, this little thing that's circled right here. And the reason that that's important is that temporal part helps us know who we are, where we are, and what's going on in the world. And when there is a problem with that area with somebody that has a psychosis, they're going to have trouble answering those questions. We do know, again, we're going back to the orange here, that those at risk with schizophrenia have more active, what we call immune cells. So those are the orange ones in the side. And people haven't done enough research to really help understand why are they growing these immune cells. I don't know if you've heard the term agnosia, and this is something that's very, very common with people with any kind of psychotic illness, because they don't have any insight into what's going on. Because, see, that's right. That's their world. Those hallucinations aren't hallucinations. Those are real. Those delusions are delusions. They're real. They aren't aware of what's going on in the world. A lot of time it's that problem with that temporal lobe. And if you look at this up, it's really from a Greek word meaning not to know, to not know a disease. And we do know that this anosognosia happens with at least 50% of people with schizophrenia, and also high rates of this with people with bipolar disorder. And some kinds can accompany the other illnesses too, as far as major depression with psychotic features. Of course, what happens to people then that have this? They are the ones who get arrested. They're the ones that lose their housing. And too many people with this are ending up in the criminal justice system. So what should you do? Okay, if you have a psychotic episode yourself or you have psychosis, we'll talk about that. But first, what should you do to help them? I think the first and most important thing is to stay calm. It has to be so scary to have hallucinations and delusions. And I think you already know that you can control people with your voice. Slow it down. Lower the volume. Be very, very directive. And if you can, get rid of all the other noise and distractions, even if you have to walk to another room or walk outside. Of course, when we do police training, we're always telling them, turn off the sirens and lights. That's going to make somebody with a psychotic illness even worse. And while you're talking, you don't want to move around the room. If they're standing, you want to stand with them, but hopefully you're not the one moving or pacing. Be sure to let them know what's going on and don't ever argue about the delusions. And I think one of the best phrases I learned in mental health, and one I still use to this day, is if someone is delusional, what do you say to them? That's very interesting. Tell me more about it. It's got to be really scary to have all those symptoms of psychosis. So you always want to reassure the person, it's okay. You're going to be safe with me. I will take care of you. Very, very important on your part to really follow all of these. Another thing, if you think the person's hearing voices, you should ask, are you hearing voices? And if they are, they're going to tell you. They're not going to lie about it because, again, it's real to them. But if they do say yes, then a very important question to ask is, what are the voices saying? Because you're not only trying to find out, is the person having hallucinations, but are they having what we call command hallucinations, where the voices are telling them to go do something? So, for example, the gentleman who killed John Lennon was hearing command hallucinations. You need to kill John Lennon, or I'm going to kill you and your entire family. Another thing, you could always ask the person, are you getting any mental health services and are you taking any medication? And if they are, find out what for. What about the person that has psychosis themselves? What should they be doing? Well, again, can't repeat this enough. The earlier you get help, the better. You've got to really learn some good stress management techniques. You got to learn about what it is. We need to educate people and find some balance in your life. You got to have some fun, and you got to stay away from alcohol and other drugs. And you've got to have that peer support available as well. I always put this in a commercial for people that if you are seeing people that are in a mental health crisis, please don't call 911. 911 is great if somebody's committing a crime or your house is on fire. If there is a mental health crisis, please call 988.
It's time to take your evening pills.
Sorry, my little Google just went off. These terms down the left are to see if somebody might be thinking about or leaning towards suicide. Do they have ideas about it? Are they abusing other substances? Do they feel like a lack of purpose in their life? Do they feel angry, withdrawn, having mood changes? Those are all red flags, is what I call them, for possible suicide. Now, I've thrown around a lot of terms here this evening, and we have to really be careful because when you hear the word psychosis, you immediately see, oh, psycho, nut job, all those other words that we use to call people with mental illness. But it's really stigma, and being stigmatized is like being branded, okay? And I think the most important thing we should remember is stigma is just another fancy word for prejudice. Because when you are stigmatizing a person, you're putting them in a little box. And, you are judging them. You are judgmental of them. So keep that in mind, please. We're going to have time for Q&A afterwards. But what I would like to do now is to turn things over to our other speaker, Jesse. And Jesse Getter is a resident of Stepping Stones. I'm thrilled for the fact that one of his managing techniques is he uses the arts, and he recently just joined our Stars of Light. So welcome, Jesse Getter. Jesse, I'm going to just slide this all down for you, so it's going to be all about you. Okay, so you need to look in here, sir, and let me pull it over a little bit more so I can see all of you. There you go, sir. So you're there. This is where you're looking. Okay, so why don't you give people some information about your illness, what it was like for you and what you've learned how now you've learned to manage it. Go ahead.
So, for a while, I have had schizophrenia, and I've had it since I was a kid. And I feel like I'm able to manage it better because I came up with coping skills that I decided to come up with myself. I'm not sure if anyone else has ever came up with these kind of coping skills, but when I was younger, I didn't really know how to manage my schizophrenia or my psychosis, and I would get out of control because I heard voices. I still do hear voices and see things, but when I got in my teens, I decided, well, I don't always have to look at the bad side of it. I could always think of it as, well, not really a disability, but like the ability to see people and other things and and hear things that other people cannot see. So I thought of it as, well, when I was a teen, I thought of it as maybe like a superpower. I know that sounds kind of weird, but it's just how I cope with my schizophrenia. Uh, I know sometimes I will still hear stuff and see stuff, but with me knowing how to manage it, I can I can just not really deal with it, but like in a way, not control it. Maybe like if you think about it, it's not about controlling the symptoms. It's more like, and it's not about going along with the symptoms. It's about teaming up with the symptoms in a way, but not by what they're telling you to do. Because I know when I was younger, I messed up on tons of stuff. Like she said that they would sometimes tell you what to do or try demanding you to do stuff. When I was a kid, I wanted to commit suicide from all this, and but I'm over it now because I just feel like it's something I have to deal with. So it's like, yeah, and I felt like I had no worth in life, and until all of a sudden I came to my senses of being in a residential, and I've been in so many mental hospitals in my past, but it's like I found out I'm not the only one in life that has these symptoms, and that I'm not the only one struggling with them. So I decided that it was best for me to be in a residential because of it, and it helps me out to learn more about it. Uh, that's pretty much all really have to say.
Well, we talked a little bit about treatment. So what kind of case management do you get at Stepping Stones?
Oh, well, I see a counselor, and I will counselor is probably the main one, but I also take meds for my schizophrenia, but it's like if you ever have the symptoms of schizophrenia or psychosis, you should always like go to a doctor first and ask them what the symptoms are. And if it seems like things are getting worse, then they could put you on something, but that's more like a last resort. Because when I was younger, when I first started experiencing this stuff, I didn't know what it was, neither did my parents. So, uh, yeah.
Okay, and you did say that your family had some education about mental illness too.
Uh, yes, my family, they they my dad, he has bipolar, and I'm not gonna lie, I have some bipolar too. And I feel like some of the seeing and hearing things can also come from the bipolar, not just from my schizophrenia. It could be the stuff combined.
Why don't you tell them about your grandparents? And how they worked at Stepping Stones and how did you find out about Stepping Stones?
Yeah, my grandma and grandpa used to work here at Stepping Stones, and I always would. I know I would usually go to my grandma more than my actual parents because she would understand more things better from the perspective of what I'm going through because she worked in this mental illness program, and so she's more understanding than my parents are.
So it sounds like you got good case management, got good medication, good family education, and you're getting some good peer involvement, you're making some friends and getting together with other people. That's pretty much the list we talked about for the better treatments. Anything else you'd like to add, Jesse? I know a lot of people get frustrated with finding the right medication. Was that hard for you?
Well, I was on so many meds because of how badly my schizophrenia and psychosis is. But yeah, for a while it was like a very hard thing to find what thing to it was kind of hard to find certain meds.
Anything else you'd like to add?
No, that's really it.
Okay, well, Daniel, we can open up things for questions if you like. I'm gonna try to get us both into the screen here. Let's see how we can do that.
Mary, do you want to stop sharing your screen, please?
Okay, how am I doing that, ma'am?
At the very top of the screen, if you put your mouse all the way to the top, it should say, oh, there you go.
Okay,
We're back.
about that, I should have done that before.
Yes. So if y'all have questions, well, first of all, I want to say thank you both. And Jesse, thank you very much for being brave and sharing your story with us. We do have a question in the chat. How do you deal with hearing voices, Jesse?
What's your secret? You said you were a superpower. Tell them what that
Well,
means.
that just means that like I just feel like well I would cope with it as in like thinking I just have the ability to do stuff that normal people, I don't want to say normal, that other people don't know how to. Uh, Basically, I can't. I just think of it as like an ability rather than a disability.
So when you're hearing the voices, what do you do?
Well, when I hear the voices, I sometimes listen to music. I would draw. Well, if I like see things actually, I'll probably draw a picture of what it looks like just to cope with it. And then if it's something that if it's like something that creeps me out a little bit, I'll probably just tear it up and I'll be like, "You're not real."
Okay, that's pretty literal of you. Great.
Yeah.
So you have problems with both with hearing voices, right? And also seeing things that aren't there.
Yes.
The arts are really helping you with the seeing things that aren't there, which is terrific. So we really do encourage that. It's wonderful. Any other questions?
Yeah, so this kind of plays into what you were just talking about. What are some other effective coping skills that you use aside from music and drawing it and tearing it up?
Uh, well, sometimes I would just I don't know how to explain it. I'll probably try getting some rest, like going to sleep for a little bit, uh, and wake up and see how that works. And I just try not to even think of like the seeing and hearing stuff. Uh, but mostly it would be like music for hearing stuff. And
Okay, so music for the hallucinations and then the auditory hallucinations and the visual ones you use your drawing.
yeah,
Those are the two big ones for you.
yeah.
How did you learn about it? Those two things.
You mean the
How did you learn that, drawing would be helpful and ripping them up and throwing them away?
well, I thought it would be easy for me to if I draw them and then I rip them up, they'll be like, it makes me feel like it's not even there anymore. It's like you're putting all that negativity from the seeing stuff in the trash.
Mhm.
So it's like you're drawing it and ripping it up, then throwing it in the trash, like it's not even there.
Any
I
other
like that. Yeah. How does one deal with a person who will not acknowledge they have schizophrenia or perhaps have that anosognosia symptom? And then this one kind of plays into it. Tips or good advice for loved ones when they are struggling or when you are struggling.
Mm. Well, one of the biggest things that's really recommended for the anosognosia is for that family member or friend to get educated themselves so that they can understand it, so they can see that this is an illness, this is not something that somebody can snap out of, that the care and the support that they're going to need to be accepting and not be judgmental. So the education and the support of the other family and friends is so important because they need people to talk to and tell their troubles to as well. We don't have easy ways to make treatment. I know NAMI had a presentation a year or two ago about legally helping people, get made to have treatment. It's not even all that difficult to do, but it's not used very much. So sadly, we're working more with the family members and the friends of the people than the actual person because we can't make them get help. Do you have any advice for people that say, oh, I don't have a mental illness, there's nothing wrong with me? Did you ever think that way yourself, Jesse?
Uh, well, I never really thought I didn't have one until people started telling me those things aren't there. So it's like
You didn't think anything was wrong,
I didn't think anything was wrong until someone told me.
right? Okay. And I don't know if you accepted that right away either. If they told you, hey, that's not real, did you believe it right away?
Probably not right away.
Yeah.
Plus, I was a kid when I first experienced it, so it's hard for children.
Mm-hmm. And what was your age when all this started?
I want to say I was at least uh 8 or 9 years old.
Okay.
Actually, there's a question about that. How can I talk to someone lacking the insight about what they're seeing and hearing is not there, especially if they're being asked to address it?
Well, again, to repeat one of my sides, one of my favorite phrases to use with people is, that's very interesting. Tell me more about it. You're not agreeing with it. You're not disagreeing with it, but you're telling the people, I'm open to listening. Let me hear what you have to say. And you'd be amazed at what the person will say to you. And again, be very careful about arguing with hallucinations and especially delusions. It's going to really put a big rift between you.
The next question, does everyone who gets a case management team have to be inpatient or can they be outpatient and have a team support to be able to have a functional life with a job and live at home?
Well, as I mentioned in that one slide, assertive community treatment is outpatient. It would not really work well in the inpatient, so it's a totally outpatient program. And it is expensive because each team has their own doctor and nurse and employment specialist and case manager. So it's probably the most expensive way to go. With what we're doing in Illinois is a little teeny bit of a drop down version of that called community support teams. And they're very efficient and effective and a lot less expensive. But you still have the team of people working with you. And you have a number that you can call 24/7 if you need some help.
I think I asked this question incorrectly, so I'm going to go back to it. So Jesse, if you're struggling, what are good tips or advice for your loved ones, or what would your advice have been to them?
Yeah, so if you're having problems with the hallucinations or delusions, what would you want to say to your parents or your grandma?
Uh, you talking about like if I'm around them
Mhm,
or
yeah. Have you ever talked to your grandma about it? You said she's one of your number one people to go to.
Yeah.
So have you gone and talked to her about this?
Uh, usually she'll like approach me, but in
Oh.
a calming way, and uh, how do I say this? She'll notice when I start. Sometimes she'll notice when I start seeing and hearing things, and I'll just tell her, like you said, we don't. Whoever had, I mean, I don't have problems with like saying, if someone asks if I'm seeing and hearing things, I don't have problems telling people because I it's part of what I am,
Mhm.
you know. But yeah, I'll.
So it's usually your grandma that comes to you first and says, Jesse, are you okay? Are you hearing voices?
Yes.
Does she ask you what are the voices saying?
She doesn't really ask me what they're saying, but I think it might be a good idea
Mhm.
because it could be saying like in the past it used to be the voices will tell me to do stuff, but it doesn't really happen like that anymore. It's more like they'll just start talking to me and even if they did say something, I'd probably just ignore it.
Okay. So it
Uh,
sounds like your grandmother's one of those calm and relaxing types.
yes, she is.
How about on the flip side, what things do you wish people would not say or do when interacting and communicating with you about schizophrenia, or maybe having just found out about your diagnosis?
Did you have trouble with people making fun of you or
Uh,
pointing
I
fingers at you?
I didn't really have uh much friends when I was younger because of it. Uh, I mean, I still don't have that many friends, but yeah, I had a problem with it. But I just those guys are just bullies, and I know just at least having just one good friend is good enough for me. Because it's just after them making fun of me, it's like if they were to look at me now and see how good I am at like managing it and that I'm in residential, and I feel like eventually, like if they were to see me today nowadays instead of like, and like back then they made fun of me, but we were like kids and stuff, and uh they probably just didn't realize that I had these symptoms because when I was in school back then, I wasn't really in a school that had anything to do with mental health at first.
Mhm.
So now if they saw me today, I feel like they'd probably be like, yeah, I was in the wrong with this. We didn't know you had any of that symptoms or saw stuff or heard stuff. Uh so it's like I feel like people could be jerks, but it's like eventually when they see you like years and years later in life succeeding and getting somewhere, they're gonna feel bad for what they did. Uh, because just because you have a disability doesn't mean you can't succeed in life.
Well, as you said, when you were younger, they were bullies.
Yeah.
Is there anything you wish people didn't bring up in like just regular conversation?
I mean, if people like bring up my schizophrenia, like ask me like what's it feel like and stuff, I don't have problems with that, but if they're like making fun of it, then I'll probably just be like, whatever. It's like it's me. I know who I am. I the best person who knows who you really are is yourself. Yes, it's good to have some support from people, but I feel like it's good to also try taking, even if I'm like symptomatic and stuff, it's still good for me to try taking accountability for myself to, I had problems with forgiving myself for all the things I've done in my past. But I'm over it now, so I forgive myself because I know deep inside my family members, they forgive me.
Mhm. That's wonderful that you could put that in the past.
Yeah.
Sounds like you've had some good counseling and therapy.
I love all the grace that you're giving yourself right now. You have a lot of thank yous in the chat. Thank you for sharing your story, Jesse. Hearing your perspective helps me have a better understanding of what others might be going through. You're a vision of hope for us all. Thank you for sharing these strategies, and thank you for being brave and sharing. I do have a couple more questions for you, if that's okay.
Yes, that's okay.
And also someone noted the book by Dr. Javier Amador, I'm Not Sick, I Don't Need Help.
Yes.
It does talk a lot about the lack of insight or anosognosia and maybe how to have a conversation in a helpful manner by the LEAP method.
It's an excellent book. It's like the book for anosognosia by Amador.
Um, how about I have a friend who is shutting people out after adrenaline psychosis. What should I do when they don't have family?
Well, you want to take that one? You want me to take that one?
Well, I'm not really sure, to be honest. You can take that one.
Okay. Well, it sounds like you know the person. Maybe you could be the replacement, okay? Because everybody needs support. Everybody needs to know that there's somebody that they can turn to, and maybe it's you. I mean, if you're in the right situation and you could reach out and let the person know, hey, I'm here for you. Talk to me whenever you want to. I'd be very open. So the more that we could be open and more non-judgmental and just available. It doesn't have to be family. Another thing you could encourage the person is go to some of the peer things that we're offering, especially the ones through NAMI. Excellent groups going and individual work.
Have a friend who is aware that their voices are not real. Is that a goal for treatment? The knowledge of that?
Sorry, so that we'll do this one together. So is it success if you say, I'm not hearing voices or I know that they're not real? Or do you just you accept the fact that, yeah, your voices, it's a symptom. It's, like low blood sugar or high blood sugar for a diabetic. I mean, how do you look at it? There's a couple different ways.
You
Do you
said,
feel like you have to tackle those and be over them to be a success, or is it okay to still have the voices?
well, like I said, it's not about controlling the voices and the voices controlling you. It's more like I don't really know how to say it. I mean, I said it's more like a team effort with yourself or something like that. But I don't really know how
You
to
accept
say
it, but you don't let it get to you.
yes, you accept it, but you don't let it get to you.
I hope that answers the question.
I have a follow-up to an earlier question, saying that they would absolutely listen to their person and not argue, but any advice for if they say you need to do something about these people whom are the hallucination?
So the question is, you need to do something about the hallucinations or about the voices?
The person who is having the hallucination is asking their loved one, you need to do something about the people that they're seeing that might not be there. How would they respond to that?
Well, I think first I would thank them for their honesty and their honesty and their candor and sharing with me what's going on. Let them know that you're a safe person to talk to, that you're a good listener. encourage them to get some help. Encourage them to talk to other people that have the same problem. And I don't know if that's getting at the question. I had a little hard time understanding it.
There might be a follow-up to that.
Okay.
There's another thank you for sharing. What if someone is dangerous to be around? What do you do?
Just to be around them is dangerous? Well, I would certainly try 988 first. That is the hotline now that is national. They claim to have a 98% success rate of being able to solve things over the telephone. There are also other things that you could do to have responses here if you're in the greater Rockford area. I mean, we have everything from our group that goes out that's composed of Rockford Police and Winnebago County Deputy Sheriffs, as well as counselors. There's also a special group of firefighters that goes out to the frequent flyers, as they call them. So there's always other people that you could call, especially if you feel afraid yourself. And again, I wouldn't be afraid until I ask the person, are you hearing voices and what are they saying? Because if the voices are saying, that they should be hurting themselves or somebody else, they need to get treatment immediately.
A follow-up from an earlier question again. So about the knowledge of having voices or having hallucinations and knowing that they're not real. Would that be a goal? Just knowing that they're not real and knowing that it's actually a symptom?
So did
I
that
think
help
so.
you, knowing that these voices that I'm hearing, they're really not real? Did that help you to understand them?
Yeah, it
Okay,
did.
okay. And how did you arrive at that understanding that these are just a symptom of your illness, not somebody really talking to you?
Well, it's just knowing that they weren't really. Can you say that again, please?
Was it helpful knowing that the voices you're having, the voices are real, but they're really something that you can control, right? They're not taking over you. Was it helpful to know that, yes, you're hearing them, but they're really, in fact, a symptom of an illness, not a real thing? Does that make sense? I mean, that's how I'm
Yeah,
understanding the question. So was it helpful to understand that this is a voice and a symptom of an illness? Okay,
yeah.
so that's what it is. It's really taking it on as a symptom of an illness and not an actual voice.
I got one more time for this one. If this is what the situation was, the loved one said, I'm hearing a party in the basement. You need to get rid of these people. Just how would you respond to that? But the people in the basement are the hallucination.
Well, personally, I would say, well, thank you for sharing. Thank you for letting me know. You're going to be safe with me. I'm going to make sure that we're safe in this house. Sometimes you might even have to do a little acting. I've done some acting in my life. You might have to go down to the basement and say, everybody out. I've seen people do various things to help people that are hearing voices. And some of them seem kind of comical, but it does help the person know, I heard you. I understand what you're saying. You're going to be safe with me. Let me take care of it for you.
How would you convince someone to take medication when they are unwilling to do so?
Well, that's a big question. I guess the big question is, why are they unwilling to do so? Is it because they really don't think they're sick? And we're back at that agnosia again. So it's why are they not wanting to take it? Some people don't take the medication because of the cost. Some people don't take the medication because they enjoy their symptoms, especially people with bipolar disorder. Some people don't take the medication at certain times of the year because they don't want to have those side effects and such around the holidays, for example. So I guess it really depends on the why question, because there are so many reasons why people don't take the medicine. If it's ignorance about the illness, then it's educating the person about their illness. And I do a lot of that by similarities, gee, if you had diabetes and you were really sick, would you take the insulin? Because this is a sickness, this is an illness. Could you take the medicine?
This one says, I'm a librarian. How do I respond to health people that are scared of those with psychosis when you know that there is no threat and they can sometimes be rude about it?
Well, it's actually going into play and becoming a stigma buster. And I hope that everybody that's listening here tonight is a stigma buster. Prejudice and anger and fear all come from ignorance, and you folks know it. I saw a lot of names on here that I knew the people today. And if we could work on that ignorance, okay, then we are also going to be working on the other problems that we have, the bigotry, the stigma. We have to get out and educate people, and starting with people, the younger the better.
Is it okay to let someone with delusional thinking live with you even though they threatened your life?
Okay, so when you were delusional, were you living with your mom and dad or your grandparents?
Yeah, I was living with them.
Okay. Did they ever feel afraid of you?
Yes, they did in the past when I couldn't control it.
So what did they do when they were afraid?
Well, they sent me to a mental hospital,
Mhm.
but
And again, I suppose it depends on what the threats are. If you ask somebody, are you hearing voices? And what are the voices saying? And those voices are telling them to hurt themselves or somebody else, you've got to call 988. You have to intercept it right then and there. So it's not even a matter of living with you, they're ill, they need to go to the hospital.
That was the last question I had. Again, I want to say thank you both so much, and we all appreciate you sharing all your wisdom. Jesse, you have any closing thoughts? Mary, do you have any closing thoughts for us?
I don't really have any closing thoughts.
Okay.
Now, the
Yeah.
only thing I want to repeat again is we need to educate the public and even educate the medical professions that when people are hallucinating, we need to ask, are you hearing voices, and what are they saying? We have to really start interceding with people. First episode psychosis. Don't think, oh, it's just something else. It's just another imaginary friend. You have to get to the bottom of that right away and find out if there's some other problem, and find some good people that are going to be very, very thorough in their assessments. And it's sad that there's a fear out there to live with or be with people with mental illness. I like to turn that around into stigma busting and show, look at what happened here with Jesse. It's like, to me, it's like a miracle, that he's turned his entire life around and he's living in a terrific place, and he's doing something really valuable with his time, and to the point where he's even joined the Stars of Light arts program. So, sometimes we have to use examples too to show other people, look at this, this is terrific. This is what could happen. And it does.
Thank you so much. I did see one more question if you guys have a second. I know we're losing some folks.
That's
But
okay.
how do you help someone over 18 get to a hospital if they would not like to go? I think that's a question we hear all the time.
That's a tough one. I think I would ask their opinion if they would be okay if I called 988 with them, and see if at least they would be open to a phone call. It happens a lot that they don't want to go anywhere or do anything, but they could actually talk on the phone. And now they even have it set up where you could text. You could text back and forth, which is very, very helpful for younger people like 18-year-olds. They don't have to either see or be seen, but somebody can pay attention to them and get words back and forth to them. So I would try very hard to try that, either calling or texting 988.
Mary, if anyone has questions, moving forward, could I give them your email address perhaps?
Certainly, and are we going to send these guys a copy of the presentation or,
I would be happy to do that if you want to share that with me.
sure, I'll send that to you tomorrow.
All right. Thank you guys. I hope you have a good night. Thanks everyone for spending your evening with us.
Okay,
Take care.
thank you.
Bye.